Today we're going to be going over the consultation process. So before we actually do the movement screening, we've already discussed just kind of some of the basic things, their history, their preferred intensity level, all of those things with the client. So when we come over here, we're going to be evaluating their movements, see where they're at, see if they have any limitations that we should be aware of before we create their tailored program. So we're going to have Adam here be the client. We're going to have him start off by taking the shoes off. And I'm going to try and show you what this would look like as if we're going through it specifically with a real client. So I'm just gonna kind of imagine that Adam is actually like the client in front of me. I will kind of do a sidebar every once in a while, look, very dramatically at the camera and tell you a little bit of advice. So we'll see how we go, but that's what that's what the game plan is. So we're gonna have him start off with a static postural assessment. So go ahead, stand right here, face me. I'm just gonna be looking for a few different things. So first of all, see if they have any flat feet here. So we do see a little bit of pes planus here, Adam. Do you have any issues with Achilles pain or any pain on the bottom of your foot?
A little bit of Achilles pain on my left side.
Okay, gotcha. So it might just be that the muscles on the bottom of the foot are a little bit weak. So that foot is caving in, which is putting a little bit of additional stress on that Achilles. So then I go up from there, see if they have any hyperextension of the knees, see if they have any anterior pelvic tilt. Go ahead, just let those arms relax at your side there, Adam. Good. All right, so we are seeing a little bit of anterior pelvic tilt. Do you have any low back pain or anything like that, Adam?
No, not too much.
Not really? Okay, awesome. Sometimes when that pelvis is tilted forward, so imagine your pelvis is like a bucket of water. If some of that water is spilling out the front, that can put a little bit more pressure on that low back. And so when we do exercises like squats or hinge movements, that can compress that lumbar spine and present as low back pain. So obviously we want to make sure that what we're doing is effective, but also safe for our mechanics. So we'll look to address that by strengthening those lower abs that help to pull that pelvis into a neutral position, along with releasing those muscles in the low back and then strengthening those glutes. All right, shoulders look pretty good. Looking to see if there's any unevenness. You can also do this for the hips. I personally don't feel super confident in that. So I'm usually just looking at the shoulders, trying to see if one is elevated and the other is depressed, or to see if we have any forward rounding with the shoulders. We have a little bit here, so we'll see if there's any tightness through your pec minor here, Adam, and or the lat on the side of the rib cage. The reason that that's important is because when we go into overhead pressing mechanics, if we are rounded forward, it can be difficult to get into a good overhead position safely. So we might have to compensate using some of the other muscles in the shoulder region, which could present in either shoulder impingement or other issues at that joint. Last thing I'm looking for, forward head posture, see if there's anything going on there. Looks like he has a slight touch of it. Usually most of us were on our phones all day, so that's pretty common. So I tell him, like, hey, Adam, looks like we have a little bit of that flat foot. See if there's any pain that comes up with any of the things that he's doing with that, and then just give him a little bit of insight as to how we might correct it. So from there, we're going to go to the knee to wall test. So Adam, I'm going to have you come over here. In a second, I'm going to have you line your foot up and do the knee to wall test. But first, I'm just going to explain kind of what the test is and why it's important. So when we're doing our squatting movements, we really want to try and keep the chest up nice and tall. That way, we're able to strengthen those muscles around the knee. Jeff, go ahead and come a little bit closer here. So we want to strengthen those quads around the knee so that when we're doing movements or just doing anything in our daily life, that force is going through the muscle as opposed to the joint. So we're keeping the joint healthy by strengthening the muscle around it. In order to do that, in order to be able to work those muscles around the knee, we have to be able to get the knee forward. So in order to keep the chest up tall, knee has to go forward. In order for the knee to go forward, we have to have length back here through the back of our leg and strength through here in the front of our leg. So right now, we're going to test that length through the back of the leg here. So I'm going to have you line up your foot in a second with the 5-inch mark. If it's usually like a guy 5'9" to like 6 feet, I'll usually have him at around 5 inches. And then if it's a woman or someone who's like, 5'7" or shorter, I'll probably have them at around 4.5 or 4 inches if they're, like 5 feet. So I'll have Adam come and line his foot up with the 5-inch mark here. I'm going to mark it off with my clipboard. I want two things. Heel stays on the ground, knee goes to the wall. So that's all I'm looking for. So Adam, I'm going to have you come over here. We're going to have you line your foot up with the 5-inch mark. Good. We'll do left foot. I don't really care too much about that back foot. And then just try and keep this front heel down. Knee goes to the wall. All right, good. That looks good. Let's go ahead. Let's switch sides. Have you been working on that?
I have been working on that.
Oh, excellent. I was going to say, last time we did it, it wasn't quite so good. All right, excellent. So his ankle mobility has actually improved since the last time that we did that. That's fantastic. That means that it's going to be easier for him to get those knees forward, which is going to allow him to keep that chest up tall while he's doing those squatting motions, which is going to allow him to emphasize that strength through the quads as opposed to turning the movement into a hinge and having to use his low back. So that's great to know. Next, what we're going to do is look at the strength of the tibialis anterior. So that's going to be the muscle on the front of the shin. So this guy is important because essentially when we're at the bottom of the squat, this guy is pulling that knee forward. If we don't have enough strength to pull the knee forward, we're going to fall backwards. So usually people won't even get that far though. They'll just stop before because they feel like they're going to fall backwards. So we're going to measure that strength of the tibialis anterior with kind of a rough and dirty test. So in a second here, Adam, I'm going to have you line up against the wall. Heels are going to be at the 16-inch mark, and then we're going to lift the toes up towards the knees. I'm looking for about a 30-degree angle here at the toes. This is probably closer to 45. I've been told I have very strong tibialis anterior, so let people take note of that. But that's really what we're looking for there. So again, that's going to help protect that knee joint, but then also just allow us to actually get down into that squat without falling backwards. So Adam, let's have you come over here. Again, heels are going to be lined up with that 16-inch mark. Excellent, good. And then while keeping the legs straight, just pull those toes up towards the knees. Excellent. So that's probably around 35 degrees. Again, go ahead, drop your toes down just a little bit there. Give me see if you can estimate what 20 degrees would look like. Yeah, right around there. So that's a little bit, that's probably around 20 degrees. So this is something that we would be like, okay, we probably have a little bit of weakness here or potentially some tightness from the soleus. Again, those two usually go in combination. If the soleus is tight, the tibialis anterior is not going to be able to strengthen and contract through its full range of motion. All right, good. So he's got pretty good flexibility through his soleus, pretty good strength through his tibialis anterior. I wouldn't anticipate any issues squatting to depth that relate to the ankle, okay? So next one we're going to do is a wall-facing external rotation to evaluate essentially how well we can get into external rotation. So this is, if we can't get into external rotation, it's probably because our internal rotators, specifically that anterior delt and that subscapularis, are a little bit tight. So we're measuring that here by just bringing those elbows down so that they're just slightly below the shoulder. And with this, I want you to think, press that shoulder into the wall as much as we can to force us to use our external rotators to find that range of motion. From here, I like to just see if people can pick that hand off of the wall without leaning back. So that's the common compensation pattern. So see if we can get our chest close to the wall and then lift that hand off of the wall to measure both the flexibility of those internal rotators and then just generally the strength of those external rotators. So if we have a lot of tightness that's pulling us into that internal rotation, again, that's going to make it harder to get into that external rotation, which is necessary for either if we're doing like a barbell back squat or if we're doing a shoulder press there, we need that external rotation. All right, so Adam, let's go ahead. Let's have you come against the wall. So arms up, good. And then go ahead, drop those elbows so that they're just slightly below the shoulders. Good. And then from here, try and lift both of the hands off of the wall while keeping the chest close to the wall and those elbows attached to the wall. So we can see not a lot of range of motion here, which means that he either potentially has tightness through those internal rotators, again, that anterior delt and that subscapularis, or a little bit of weakness through those external rotators. And so we want to make sure that we're aware of that before we create his programming. All right, fantastic. We're going to keep going. So now we're going to go ahead and take a seat. We're going to do a seated toe touch. So I'm going to have you go ahead and take a seat next to me here, Adam. This is going to be testing the flexibility of the upper calves and the lower hamstrings. So those guys are super important because when we go into hinge movements, if we don't have enough flexibility through here, it's going to be hard for us to actually get our butt back. So we're probably not going to be able to find very much range of motion, which means that we won't be able to load those hamstrings and those glutes in that position. So really important for making sure that we're able to actually execute our hinge movements properly. So I should mention, usually when I'm doing the consultation, I will explain in detail the knee to wall test and how that relates to the ankle mobility and how ankle mobility relates to quad health, knee health, and our ability to actually execute squats properly. And then I'll talk about the tib anterior. After that, I've already demonstrated that I have a lot of really good knowledge, and usually the client will be confident that whatever we're doing, there's a reason, which obviously there is, And so you don't have to explain nearly as much. I'll usually explain on those two tests, so the knee to wall test, that tib anterior test, and also just kind of make those notes during the static postural assessment. But it's also important to know if we try and over-explain everything like I'm doing right now, it's going to be super overwhelming. So you're going to have to watch this video a few times. That's totally fine. But just really try and think about what the movement is, why we're doing it, and then take note about which ones I'm really trying to emphasize to talk to the client about and make sure they understand what we're trying to execute here. So with the seated toe touch, again, this is just for your kind of information. It's about that hinge movement, getting the butt back, finding that range of motion. Go ahead, scooch the hips back against the wall here for me. From here, legs stay straight. Reach, see if we can touch our toes. All right, awesome. Probably has enough range of motion there. Next one, we're going to come down to the mat here. So Adam, I'm going to have you lie on the mat. Your head is going to be towards this back wall. Feet are going to be towards the front door. Let's have you on the left one. Yeah. Good, perfect. Just like that. From here, I just want you to bring those knees into the chest. And so what I'm looking for, exactly, grab those knees, bring them into the chest. So what I'm looking for is to see whether or not his low back comes off of the ground. Think about it. This is essentially a deep squat position here. So if he can't get to parallel or slightly below without his low back kind of coming off of the floor, then that means that he probably has some tightness there in that lower back that's going to limit his ability to get into a deep squat, which means that we'll probably see that butt wink when he gets down to a low depth. We're seeing a little bit of that here with him, not a ton. So Adam, pull those legs in as much as possible. Good. So you can see that tailbone wanting to round a little bit here. It's not terrible though. So I would anticipate that he probably is going to be able to get into a deep squat with a little bit of butt wink there at the bottom. All right, next one that we're going to do is going to be lying shoulder flexion. So knees are bent, tuck the thumbs into the hands, arms go overhead. So this is measuring the flexibility through the lats here specifically, also the long head of the tricep and a little bit of the teres major, but lats are the main one that I'm looking for here. If they can't allow for those arms to relax on the ground, again, that means that they're going to probably have troubles trying to get into a good overhead pressing position here. So Adam looks pretty good. He's able to get a good contact with that knife edge of the hand onto the ground. Go ahead, try and relax to see if those elbows can touch the floor. So this is what we see with most people, is that their elbows are off of the ground and they're kind of internally rotated with that humerus. Now this is a little bit advanced. It's not something that we need to, that you need to necessarily be aware of, but this is good to know because that usually is indicating potentially some impingement in that glenohumeral joint, in that shoulder joint, or tightness through that capsule. So again, that's pretty advanced. Don't worry about that. What we're just looking for is whether or not their lats are really tight and are going to be impeding them from being able to do an overhead press. All right. So from here, Adam, I'm going to have your hands next to your side. Go ahead, lift the feet up off of the ground. Hips are going to be at 90, knees are going to be at 90. We're going to be assessing the strength of your lower abs. So again, we talked about it during the consultation. Those lower abs are what are going to pull that pelvis into a neutral position and allow us to safely do our squats and our deadlifts. So really important that we have adequate strength there. A lot of people will lack the strength just from sitting all day. They won't necessarily have that requisite strength. So we're going to assess that now. So hips are at 90, knees are at 90. We're going to drop one heel onto the ground, and the other big thing is that the back stays flat on the floor the entire time. Good, just like that. And so there's going to be 4 progressions. This is the first one. Adam, do you mind if I put my hand on your low back to see if it's coming up off of the ground? Okay. Always ask, obviously. All right, good. I can't get my hand underneath his low back. That's solid contact. Go ahead, straighten those legs straight up into the sky. Good. Same thing, dropping one to the ground and then the other alternating. Keep those legs completely straight the whole time. So this is just the second progression now. Excellent. Go ahead and bend those knees back to 90. Good. Now both heels touch the ground at the same time. Knees stay at 90. Beautiful. All right, go ahead and straighten the legs and both at the same time. Good, let's get a couple more. So I'm starting to feel a little bit of that pressure come off of the ground. Adam's obviously super strong, but this is a really challenging one for people to execute correctly. Good. Most people will usually be utilizing their low back when they're at that last progression. So you'll see kind of that rotation through the pelvis forward and backwards. So that's something that we want to be aware of. All right, next one that we're going to do, we're going to flip over and do a prone Y test. So we're going to be here. This one is going to be assessing the strength of our lower trapezius muscles. So these guys are super important for being able to get that shoulder blade in the correct position. So if we have a lot of weakness through there, the shoulders, again, are probably going to be rounded forward, which is going to make it challenging to get ourselves into a safe overhead pressing position. So arms are going to be straight. Really try and make sure that they're out of their upper trap so they're not shrugging up. Neck is long, and then lifting those hands up off of the ground to get a lot of good contraction through the lower traps. And then you also will get some through those delts, through the shoulders. So good. Go ahead and lift those hands up off the ground for me. Excellent. Come down. Let's get a couple more. Good. Nice and relaxed through the upper traps. Beautiful. So we're not seeing a lot of shrugging happening here. That's great. That means that we have pretty good activation of those lower traps, which is going to help keep that shoulder in a safe position when we're in an overhead pressing position. All right, fantastic. Let's keep going here. So we're going to stay on the ground. We're going to bring the left heel up to the glutes, reach back, grab, see if we can bring that heel to the butt. We're just testing the flexibility of the quad. If they have super tight quads, this also can be a limiting factor for squat depth, just because they don't actually have enough range of motion through that muscle to get into a lot of knee flexion. So if this is uncomfortable for them, then when we load it, it's probably going to be a lot more uncomfortable for them. Also, a lot of patellar tendon issues can sometimes arise because we have a lot of tightness through the quad. So knee pain, this is one of the first places to look, whether or not they have super tight quads. All right, go ahead, show me that one more time. All right, so we definitely have a little bit of tightness there in the quads. No low back pain though. Good. No knee pain. All right, awesome. So it's just tight, but it's not causing any pain. That's great to know. Go ahead, do the other one. All right. You can also see his knee is kind of drifting out. Go ahead, try and bring that knee underneath. Good. All right. So we still have a couple of inches here. Definitely some tightness through the quads. All right. From here, we're going to test the strength of the hamstrings. So oftentimes knee pain can be a result of weakness through the quads and tightness through the quads, but then also weakness through the hamstrings, right? Because we have to stabilize the joint, the knee joint, from both sides. So the hamstrings and the quads are two of the main players. So oftentimes people have tight quads and also potentially weak quads. They oftentimes will have weak hamstrings as well, especially if they have those tight quads, right? Tightness on one side usually is going to lead to weakness through a full range of motion on the other side. So what I'm going to do now to test that is manual muscle testing of the hamstring. So Adam, go ahead, bring both of the heels up to the glutes. Good. Tuck the pelvis so that your low back is in a safe position. Good. Knees together for me. Excellent. And from here, I'm just going to try and pull those heels down towards the ground. Now, Adam was a professional sprinter, so his hamstrings are incredibly strong. But you could see, pull them up again. He can't, all the way up. Yep, exactly. So he's already cramping. So you can see that he doesn't have a lot of range of motion, especially at the end range of motion when we have deep knee flexion. So while he's extremely strong, especially at 90 degrees, in deep knee flexion, where those heels are way up towards his glutes, he actually doesn't have a ton of access to those motor units. So that's something that we could work on together to help decrease the chance of knee injury in the future. All right, awesome. Now we're going to do the opposite. So go ahead, bring those heels to the knee or to the glutes. Yep, excellent. And then from here, I just want you to try and press those legs, straighten those legs. Excellent. So this is just testing the strength of those quads on the front of the thighs. Again, a lot of times if people have knee pain, they'll have a lot of challenge trying to straighten that leg, especially when we're in deep knee flexion. So that first little bit, you'll feel almost no pressure on your hand because they don't have a ton of activation of that quad when they have a deep knee bend. All right, awesome. Next one that we're going to do is going to be hip internal and external rotation. So you're just going to stay here. We're going to bring the knee up. Good. Hip stays on the ground. And then this is a little bit confusing, but when the heel drops in, that's actually external rotation of that femur. Good. And then when the heel goes out, that's internal rotation of the femur. A lot of the times, lack of internal and external rotation of the femur is going to relate to low back and hip dysfunction. That's a video for another day, but just something to be aware of. All right. So next one we're going to go a little bit into what's called our global movement pattern. So we've seen most of our flexibility. We've still got one flexibility test left that we'll do a little bit later, but just since it flows well with the other tests, we're now going to go into our global movement pattern. So we're going to start with the push-up. So I want to see how all of this mobility integrates into the movement patterns, whether or not we have access to that range of motion and whether or not we have strength through our stabilizers to execute that form correctly. So we're going to start with the push-up. I'm going to have you hop off of the mat, Adam, here just to the left, just so that you don't feel restricted with your hands. Oftentimes, I'm just going to let you do a couple of push-ups here. There's a million ways to do the push-up. None of them are right or wrong. There's just going to be different things that are going to be emphasized with different push-ups. I'll probably give you a couple of cues on how I like to have you do, or how I like to do push-ups rather. All right, give me a couple more. All right, excellent. And go ahead and relax. So obviously, Adam's a professional. He's doing an excellent push-up. I would probably just say some of the common things that we see is, hey, keep the hips a little bit tucked because we're arching that back. And then usually, I would say that even for Adam, his hands are a little bit closer than what I'll normally cue. What I like to see is arms at 45 degrees. And again, the important thing is to know is that having the hands a little bit closer, it's not wrong. It just means that you're going to be focusing a little bit more on the triceps. I like to have hands just a touch wider, which is going to allow for that 45-degree angle with the torso, which should allow us to get a little bit more engagement of the lats and those shoulder stabilizers as we execute the push-up. But as you saw, Adam was doing an awesome job of keeping those elbows over the wrists to, again, maximize that lat engagement while keeping the hips tucked and not reaching with that head. So most people won't be able to do that. If they can't do the push-up, then I'm going to have them see if they can hold at the bottom for 8 seconds. If they can't do that, then I'm going to see if they can do a knee push-up. So this is just trying to see where they're at in that progression, just to give us a little bit of an idea of what might be appropriate starting out. All right, we're going to pop up here. We're going to do a shoulder pass through. So this is the last mobility exercise that I was talking about. So I'm going to give Adam the PVC pipe here in a second. The pipe is going to be in the crease of our hips. Arms are going to stay straight. We're going to try and come up and over. And then if you feel like your arms are going to pop out of the socket, just go ahead and come down. We haven't signed any waivers yet, so I want to make sure we don't dislocate anything quite yet. All right, so go ahead, and in a second, we're going to be here. If you bend your arms, that's when we know that we need to widen out that grip a little bit. So, yep, exactly. So the PVC is in the crease of the hips. If he bends forward, go ahead and bend forward for me. Good. That PVC is pretty much right there in that crease. Good. So now trying to keep the arm straight, go up and over for me. Excellent. Good. And this is going to be telling me whether or not he has a lot of tightness, especially through that pec minor, which is going to be at its most stretched position when the arm is at that 120-degree angle here of shoulder flexion and going backwards. All right, good. So he has pretty good shoulder mobility there, which is great. That means that things like overhead pressing and rowing might have a little bit more access, but as we saw, we are lacking a little bit of that external rotation there, and the lats are a little bit tight, nothing crazy. So we'll take a look and we'll see what his overhead pressing looks like as a result of some of those flexibility limitations. All right, next, we're going to go ahead and take a look at his squat pattern. So Adam, I'm just going to have you stand here, feet just slightly wider than hip width apart. Go ahead, face the mirror, and try and squat down as low as we can. Hands are going to be in front of us. Again, so this is, go ahead and just give me like 10 reps, nice and controlled. This is just me trying to see what they currently do for their squat pattern. A lot of times people will be somewhat familiar with the squat, but they might have done different things in the past. So I just want to kind of see what they naturally do, and then I'll give them a couple of cues based off of that. So what we're seeing is he's getting good depth. Go ahead, pause at the very bottom. So you can see though that low back tightness, we're getting a little bit of that posterior pelvic tilt, that butt wink. So when we assessed with the knees to chest, we saw that tailbone coming off the ground a little bit, which means that we probably have a little bit of tightness there. Go ahead and come up. Ankles look good. If he wasn't able to get to full depth, so go ahead, go like almost down, all the way down. Good, exactly. So we don't quite have full depth here. Now we have to try and figure out what is happening. So if we saw, go ahead and come up. If we saw that he had a lack of flexibility in his soleus or a lack of strength in that tibialis anterior, our hypothesis would probably be that it's an issue at the ankle. Or that might be the first place that we would look. So in that case, we would have Adam come over here and step on the heel wedges. What this is doing is it's artificially increasing our ability to get the knee forward. So we don't have quite as much of an angle here at the ankle. So essentially, right, we're propping it up. If it's on the ground, we need to have more flexibility through that soleus to get that same level of depth. Also, we have to have more contraction through that tibialis anterior. So if it is an issue at the ankle, usually propping the heels up is going to help to alleviate that. If we're still seeing issues, the biggest things that it probably could be is weakness in those quads. So they just simply don't have the strength through the lower part of their quads. Again, especially for older people, if they're always sitting in a position where they're never having to actually get into a full depth squat, these muscles are going to be really weak in this specific position, right? So they might be strong here, but getting here into this position where those muscles are really long, there's a lot of tension that they're not used to, that might just be too much. They can't actually get out of the bottom. So sometimes people will go down and they just can't get up, or they'll go down and they'll have to lift the hips and then use the back to get up because they don't have that strength through the quads. If we are still seeing a ton of butt wink though, then that probably means that we have a ton of tightness through that low back that's restricting us from being able to get into that position where we have a lot of hip flexion and a lot of length through that lower back at the bottom. All right, next one that we're going to do is going to be split squat. So split squat, Adam, I'm going to have you be here, right foot forward, left foot back. Good, chest stays up nice and tall. Drop that back knee to the ground and come up. Good, so this one, go ahead, just give me a few reps. What I'm looking for is whether or not we have any knee valgus here, so any weakness through the muscles stabilizing the hip on either side, so those adductors on the inside or those hip abductors on the outside. I'm also looking for to see whether or not that front knee comes really far forward. So go ahead, pretend like that knee, exactly. So what we're seeing here is that he's very long through that back leg. So oftentimes, if people don't have the strength through that back leg, they try and find stability by lengthening through the hip flexor instead of contracting that quad. Go ahead and do one properly. Because in this position, it requires a lot more stability through that quad muscle. So if they don't have that, they're going to try and find that stability by stretching through that hip flexor and driving that knee forward. Good. In that case, what I'd have you do, go ahead, pop back into it for a second, is I just say, try not to let that front knee touch my clipboard. That's going to give them a more vertical posture, and we're going to be able to evaluate more effectively whether or not it is that back knee. Oftentimes, when people don't have that strength, what will happen is they'll go down, and then they'll push back, and again, kind of hinge out of the movement. So just be looking for that. All right, from there, we're going to go into single leg balance test. So super simple, just stand on one leg. Usually I'll have them go for about 20 seconds. Go ahead. If people have flat feet, oftentimes we'll see that their single leg balance is a little bit compromised. Adam's doing a pretty good job here. Go ahead and switch legs. Obviously, for older individuals or anyone who's looking for more health and longevity functional training, this is going to be a big component. All right, good balance. I like that. If they have done a hinge before, which should be marked on kind of their program or their consultation form, I am going to have them do a couple of dumbbell RDLs just to see what that hinge form looks like. So that might be something that's either marked on the consultation or something that we talk about during the consultation. Be like, hey, like, have you done a hinge movement before? Deadlifts, RDLs? If so, let's take a look and let's see what that form looks like. I'm not going to go over it too much in depth here, but essentially we're just looking for kind of the classic errors. So whether or not, they're turning it into a squat and just staying vertical, whether or not their legs are straight and they're going to their low back, essentially trying to see how much coaching they're going to need and whether or not they can probably safely go into a hinge movement after one session or whether or not they're going to need multiple sessions in order to execute that. All right. From here, we're going to go into the seated row. So we're going to see what the rowing mechanics look like. So Adam, we want to see kind of what our rowing mechanics look like because we want to complement those pressing motions with rowing motions. Before I have you sit down here, I'm actually going to have you stand up and face the mirror. Most of the time when people do rowing motions, what they do is they'll dump that shoulder forward and use those upper traps, which again, compromises that shoulder joint and puts us in a risky position and could potentially injure the rotator cuff as well. So instead of being forward with the shoulder, we want to think nice and rolled back, chest open up, mid traps and rhomboids activated. So think hands out in front of us like we're driving a car. We're going to row back into our belly button. Nice big chest. Good. Allow for those shoulders to rotate. Excellent. Let's get a couple more reps here. So rotating those shoulders. Beautiful. And I'll usually do a kinesthetic cue here just so that they can feel what it feels like to have me assist them into that external rotation to help increase that contraction of the mid traps and those rhomboids on the mid back. All right, that looks good. Let's see if you can do it under load. So I'm gonna have you take a seat here. We're gonna grab the triangle. Usually I'll set it up to like 70 pounds or something like that, something light, just obviously use your judgment. Shoulders rolled down and back, rowing into that rib cage, chest nice and big, pinch the shoulder blades together in the back. All right, let's go ahead and see what that looks like. So we'll have you grab the triangle and then take a seat. Good, toes go up onto that slanted part, excellent. Sitting up nice and tall, beautiful. And then go ahead, give me a few reps. And so if I'm not seeing good rotation, then I'll usually give them that kinesthetic cue again. Excellent, nice big chest. Try and pinch my hand, yes, with those shoulder blades. Beautiful, really nice. All right, go ahead and relax. That was excellent. I really like how that looks. All right, next one that we're going to do is going to be a seated shoulder press. So we're taking a look, seeing if that slight mobility limitation with the lats and or the external rotation impacts the overhead pressing mechanics at all. He had really good activation of those lower traps though, so that might be enough to get us into the correct position. So Adam, I'm going to have you take a seat here. Arms are going to be at a 45-degree angle. Abs are engaged, so we're trying not to arch that back. Pressing up and overhead, and it's going to feel really far back, but I want the elbows to be slightly behind those ears at the top here without arching that back. So again, we're stabilizing using those lower traps and allowing ourselves to get into a good position to work the shoulder without compromising the integrity of the joint or risking injury. So let's go ahead, let's have you do a couple of reps, see where we're at with that. Good, yep, exactly. Arms at 45, beautiful. Good. Give me a few more reps. Excellent. That looks good. Good. And that might even be just a touch further back than we need to go. Yeah, right there. Perfect. Give me somewhere right there. Beautiful. Good. Give me a couple more reps. Just like that. Excellent. Excellent. Nice job keeping those arms at the 45. That's going to be in the scapular plane, which is going to keep those shoulder blades in a safe position and facilitate that upward movement of the scapula. Good. All right, so that looks really good. What would be a common one to see is going to be, again, if they arch their back, so they're here, you see that flare through the rib cage, or if the rib cage is down, but those elbows are in front of the head, or in front of the ears rather, and we're utilizing those upper traps to stabilize in that movement. So in that case, I would probably have us start off some sort of modification. A half kneeling landmine press is usually a good place to start if they do have some mobility restrictions there through the lat. All right, we just got a couple more here. So chin up progression. Adam, we're going to do a chin up progression. So in a second, I'm going to have you here. Hands are going to be facing us. I'm looking for three things. Whether or not we can get those shoulder blades down, get that scapular depression, and then if we get any bend through the elbow, and then if we do, see if we can get that chin all the way up and over. So I'm looking for a little bit more vertical posture here. We want to try and avoid swinging out. Again, that's not wrong, but that's just not going to allow us to engage the core in a meaningful way that integrates that upper body. So go ahead, pull those elbows straight down to the ground while keeping those hips tucked, core engaged. Yes, very nice, good. So we see that he's getting that scapular depression. Obviously, a lot of bend through the elbow. Chin is all the way up and over. Good. And go ahead and come down. Most people won't be able to do that when they come in, so just kind of making a note, can they get that scapular depression? Do we have any bend in the elbow? Are they able to get most of the way, but they're just lacking that strength in the last little bit, just so that we know where we're starting out. All right, next one we're going to do is just to see dead hang for time. So a lot of times people will have troubles with their grip strength, and that's obviously a very easily measurable variable that we can improve upon, especially in that first couple of months of training. So we're just going to have them here. Again, we're going to be in that chin up grip, and then we're just going to have them take the feet off of the floor and hold for as long as they can. Goal is going to be 30 seconds. I would say that less than like 40% of people will probably achieve that. Obviously, will be a little bit different men to women, but just make a note of that and then see if we can improve on that in that first cycle. All right, last one that we're going to have them do is 30 seconds on the air bike. This is a cardiovascular test. I'll usually say, spoiler alert, this is not anyone's favorite assessment, but it is going to give us a really good idea of where we're starting out with that short-term anaerobic endurance. So I'm going to have you toss your shoes back on. And we're looking for around 10 calories in that 30 seconds. So if you can do that, amazing. Most people won't be able to do that when they first come in. That's totally fine. That's why we're here. All right. So we'll go ahead. We'll come over here. Usually most people are going to be between 3 and 5 notches here at about Adam's height. Are you 5'9"?
Yeah.
5'9". I would say 4 notches is perfect. For 5'6" and under, I would say 3 notches. For like 5'10" and over, you might be around the 5-notch mark. Just use your best judgment. And then we're going to have him hop on the bike. So have you used one of these bikes before, Adam?
Yes.
Okay, awesome. So you know that you can push and pull. So it's going to be also measuring that upper body. It will start when you start. We're going to go 30 seconds all out. Try and get around 10 calories or more if we can. So go ahead and begin. Excellent. Really nice, Adam. Here we go. Beautiful. We're at 7.6 calories halfway through. You got it. Here we go. Fight through that last 10 seconds. You got it, baby. Woo. Feel the burn. We got 5 more seconds left. 5 more seconds. All the way through. All the way through. And time. All right. 16.1. Way to go. New community strength Austin consultation record. We're proud of you. There's no cash prize, but there is bragging points. All right. So after that, they're going to be wiped. I usually will tell them like, hey, everyone pretends like they're fine. You probably won't be able to breathe. That's totally to be expected. And then we'll go over the results with them. Talk about, hey, so a lot of good things. We'll just pretend that we already went and sat down with them at the desk. A lot of good things. You obviously have really good starting strength. A lot of those biomechanics for those basic lifts look really good. So we're going to be able to skip some of that introductory stuff, get straight to the fun stuff. We did see that there was a little bit of room for improvement, especially with that mobility. So we'll try and address that because that's going to really allow us to be able to continue to do swimming and all those overhead movements like tennis that you mentioned that you really want to be able to accomplish for decades to come. Does that sound good?
That's great.
All right, awesome.
Thank you.
All right, so that is the consultation. I know it's long. I know it's complicated. It's something that we're going to go over together. But what I really want you to take away from this is we want to have a good idea of what the movements are, what they're testing, and why they're important. You'll explain some of them to the client to make sure they have a good understanding that you know your stuff. But really, it's for you to know, all right, this is where they're starting, and this is how I create a program that is going to address their goals, what their body needs from a mobility standpoint, and then also what they could use from a strength standpoint. If you have any questions, obviously reach out, and I'll see you guys next time. All right, we're